Hello guys, welcome back to the channel. So in this particular video I'm going to be talking about SCBU. This is the continuation of the nursing internship video that I did on pediatrics. So I'm going to be linking it at the right hand corner of this video so you can watch it before you watch this one so you can understand it very well. This particular video is going to be about, let's say, give or take 10 minutes long, and I'm going to just show you what I did on a normal shift. This was after actually an afternoon shift, so that's why it's going to be looking as if it's very calm and all. So I'll just explain to you what we're doing and what we actually do as nurses in SCBU units. SCBU is an area in the hospital for newborns who need more routine postnatal care. So the babies here may be premature or may be recovering from a difficult birth, may be poorly fed, or may need extra oxygen or temperature support. So most of our duties as nurses in SCBU is that we take assessment, we monitor the baby strictly, administer medications and treatment, we support their feeding. We also teach parents how to care for their babies, and we carry out phototherapy, monitor inputs and outputs, and feeding charts, and we also balance these charts, the input, the output chart, and the feeding charts. So when a baby arrives at SCBU, the first thing that we do is that we perform a thorough vital signs check. We check the temperature, the heart rate, the respiratory rate, and oxygen saturation, which is very important. We weigh the baby, then we review the maternal and delivery notes depending on the ward that the baby came from. We also identify the immediate needs of the baby, because some of them might need immediate oxygen, they might need their glucose to be checked, and we might have to give warmth. This initial nursing assessment that we do, it determines how closely the baby will be monitored and what interventions will be needed. In some other cases, while we are administering medication, we might have to insert and manage IV lines, nasogastric tubes, either for feeding or for giving of medication. Then some babies may have dressing, like wool dressing, that we have to change from time to time, and it has to be an aseptic technique. Many babies in SCBU might need breathing support, like I said earlier, so that is less invasive than mechanical ventilation. So what we most times do is to give CPAP, and it will help in this area. So in cases of jaundice, nurses run and monitor phototherapy. So you can see the blue light in the video, that's what it does. And while we give this phototherapy, we'll make sure that the baby's eye is correctly protected. Also, we maintain hydration and temperature check too, because phototherapy has the tendency of increasing the temperature of the baby. Another very important thing we do in SCBU is to feed the baby. So we might feed the baby with express breast milk or breast substitute, depending on the condition of the baby and depending on the condition of the mother too, because some mother have not yet expressed breast milk, so we have to give the baby substitute. And the amount that we give to each baby varies. It's not fixed for all the babies, so it varies depending on the baby's condition, depending on the baby's weight, and depending on, most times it is prescribed, so you just look at the folder and give what is prescribed. Another thing that we encourage mothers to do in SCBU, because I told you guys that we normally talk to the parents and tell the parents how they are supposed to take care of their child. So one thing that we encourage the mothers to do is skin to skin contact with their baby. So we basically call it kangaroo care. So carry the baby up to their chest and then just hold the baby. So this might seem as something very simple, but it's very important because it helps to stabilize the baby's temperature, and it can improve the connection between the mother and the baby. And most times too, it helps the mother in breastfeeding. As we are doing all these things here, we have to remember to document at each point. If you watch the video, when I do one or two things, I'm always going to the further to write them down so that you don't forget. Sometimes we might decide to pile it up in our head, but then we have to document at each time we carry out a procedure, or we give medication, or we do anything for the baby. We have to document. It's very, very important. Documentation shows that you have done the procedure, and it also shows the particular time you did the procedure. So that's why it's very important to document at the point when you did the procedure. The alarm or the incubator goes off sometimes to show that either the temperature in the incubator has been tampered with, or is not the normal temperature is supposed to be. Sometimes it shows that the fluid is no longer passing, the fluid connected to the baby is no longer passing. So we just have to go and sort it out, and then every other thing will be back to normal. While you're working, especially in SCBU units, this applies to every unit, but especially in SCBU units, please ensure that you always maintain hand hygiene. It's very, very important. Maintain hand hygiene at every time. So guys, that is the summary of how a SCBU unit looks like. Miss calling SCBU unit. You understand? But that is a summary of what it is and what it looks like and what we do in SCBU. So if you enjoyed this video, consider sharing it to your fellow nurses or someone in the medical field that might benefit from this. And I'll see you guys in my next video. Subscribe. Bye guys.